to the session of the Global Mental Health Action Network, in which we're going to be talking about World Mental Health Day. I'm really delighted to have you here. Apologies, I'm not Sarah Lewis. My name's Sarah Kline, but Sarah Lewis, unfortunately, is not very well, so I've taken over from her as chair today. For those of you who may know, United for Global Mental Health has been working with the WHO and other partners, including the World Federation for Mental Health, IFNSA, and others present here on mental health and World Mental Health Day in particular for the last few years, trying to increase the profile of World Mental Health Day and trying to drive change through action on the World Mental Health Day. Today, what we're going to talk about is basically to introduce the theme for World Mental Health Day, provide GMHAN members with an update on what's happening, and share best practice examples of what World Mental Health Day campaigning can look like. For those of you who are joining in the audience, please do introduce yourselves in the chat. It's always lovely to know who's here. So please put your name in the chat and where you're from. And if you have information that you want to share about your plans for World Mental Health Day, we'd love to hear about those. I'm going to go ahead and just remind people that there are obviously links to the notes afterwards, and there will be a recording of each session on UnitedGMH's YouTube channel. So if you want to access those, please do. And there'll be more information in the chat as we go along. So we have a great panel here today. I'm going to briefly ask each of them to introduce themselves. So starting with Pradeep, would you like to introduce yourself and your organization just briefly?
Hello everyone, it's great to be here today with all of you. I'm Pradeep Gunarathne, the National Organizer of Consumer Action Network Mental Health LANKA. Consumer Action Network Mental Health LANKA, otherwise GMHAN LANKA, is a consumer-led community-based mental health organization based in Sri Lanka. Actually, we have around 70 member groups in all around the country. So we work closely with the government and international organizations to be about the protection and empowerment and provision of services for the people with mental health problems.
Thank you, Pradeep. Ife, would you like to introduce yourself and say a bit about Mani in Nigeria?
Thank you, Sarah. My name is Ifedayo. I'm the Executive Director of Mentally Aware Nigeria Initiative. What our focus at Mani is to provide support for individuals living with mental illnesses and disorders and individuals with mental health problems. We also do a lot of work on advocacy. We try to influence policies, work closely with the government, both at federal and state level, to ensure mental health for all. We very recently launched a report on the effect of COVID-19 on the mental health of Nigerians.
Thank you, Ife. I was really delighted to see that report and support it. It's important. There's some information in the chat for people about the organizations that Pradeep and Ife are representing. And there will be more coming shortly from other speakers as they join us. But Pradeep, do you want to start? Why is Mental Health Day important to you and your organization?
As a brief, I think Mental Health Day is important because mental health is important. Our mental health is actually the people's mental health is more needed and more to be considered in this now, after the COVID pandemic and other economic crises all around the world. So these kind of situations worsen the mental health issues that people have. So even before COVID-19, the governments and the international organization could not complete the need or provide the full need of mental health issues or mental health services in the globe. So Mental Health Day was something to kind of an eye-opener and make people to think about mental health and why it is important, and to pay kind of attention from the state sectors, policymakers, community, everyone, that our mental health is important. So for Sri Lanka, I think it is much needed these days because we are in the worst economic crisis in the world for like 70 years. So we are in a shortage of drugs, we are in a shortage of other essentials, So people have vast issues of kind of mental health issues. So this year Mental Health Day is really important for us because we want to talk about the mental health of people living in the country. So I think it's a really important day because we know for every important thing we have a day because we want to talk about. So Mental Health Day is the same, like we want to talk about our mental health. So we are going to talk.
Thank you, Pradeep. And I'm going to come back to you in a bit because Pradeep and his team have done incredible work around World Mental Health Day in Sri Lanka over the years in raising the profile of the issue. So we'll come back to that. Ife, would you like to talk about why mental health is World Mental Health Day is important to you? Then I'll come to Mohammed. Thank you.
Okay. World Mental Health Day is particularly very important to me because it's my birthday and of course my wedding anniversary too. So it's like a really full day for me. But more importantly, in Nigeria, where mental health takes the backstage, nobody really wants to talk about mental health, and there's been a lot of neglect in the mental health space. Mental Health Day is very important for us as organizations because that's the day when we get so much attention, from the media, from government, even workplaces hold mental health programs and, do special events around World Mental Health Day. So it's one particular day that we look forward to because it brings so much attention to mental health. And more importantly, it's a good day for us to educate. There's a whole lot of education, awareness about mental health, and even focus on mental health organizations doing great work in the space in Nigeria. And it's also a very great day for us to encourage young people, particularly those in the universities, to look at mental health related fields of study to specialize in. It's also a very great opportunity always for us to connect further with individuals who are living with mental illnesses and mental health conditions. It's a day where they feel appreciated, where they feel supported, they feel not alone because we know what the effects that of stigma on individuals living with mental health conditions. And this is a day where, everyone says, we understand how you feel. It's okay to feel that way. And we're here to give you that support. It's also a very important day, of course, for us to pull our voices together, push our advocacy efforts, also get the government to hear us because all the media bodies are always very willing to, do special features and insights among the rest. So it's a particularly big day for us, not only in Nigeria, but I'm sure across the world. Thank you.
Thank you, Ife. That's so exciting to hear about your birthday and your wedding anniversary. But you made lots of great points about the importance of the attention that World Mental Health Day brings, the importance of education, of awareness, supporting people with lived experience. It can be a great day, but it can be a really hard day. And there's a lot of content in the media that can be hard to hear. So I think those are all really important points. I'd like to move to Mohammed. Welcome. Would you like to introduce IMSA and then talk about why World Mental Health Day is important to you and your organization?
Yes, of course. Thank you so much. Can you confirm you can hear me well? Okay, perfect. So yeah, my name is Mohammed and I'm the liaison officer for public health issues from the International Federation of Medical Students Associations, an organization that has been present there since 1951, representing more than 1.3 million medical students from 129 countries all over the world, with the vision of uniting medical students together for global health. And why would Mental Health Day matter to us, and why does it matter in general? I believe World Mental Health Day serves as a reminder that we still do not do enough when it comes to health in general. When we speak about health, health is the state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. However, when we get to ask ourselves, do we have a day for physical health in general? The answer is no. We have a day for different diseases because people understand how important physical health is. However, why do we still have a day where we do so much work on the World Mental Health Day? It's because people do not still understand why mental health is important and why is it part of your own general health and well-being. So that's the first point. It serves as a reminder of the importance of the inclusion of mental health. Like it's already included as part of the definition of health, but we need to do rather than just include it in definitions, we need to do more in terms of this. And in addition, also this day serves as, like as colleagues mentioned, it's a day for us to do more, to advocate more, to raise awareness more, in order for people, not just people living with mental health issues or mental disorders, but also people around them. Everyone need to understand what mental health is and why is it important. So this day serves as a day for all of us to join forces to raise awareness and to advocate for education and for more action when it comes to mental health. And why does it matter specifically for IFMSA? For IFMSA, we have a specific program on mental health in which we advocate and we help and support our national member organizations and medical students to enroll their activities on whatever mental health relevant topics into this program so that we can showcase their efforts and be able to join national member organizations who do similar actions in order to reinforce and strengthen more their mental health activities. So yeah, that's from my side. Thank you.
Thank you so much. That's really inspiring to hear what IFMSA is doing to support medical students and their associations. There have been some really great feedback as well in the chat. So Louise has said, I agree with Ife's points as to why it's important. It's a high profile opportunity to make conversations about mental health accessible. And she goes on to add more comments there. And then, so you could read a bit more about what Louise is saying. And then you have a comment from Valentina talking about World Mental Health Day is an important as a day to raise the profile, celebrate mental health, reflect on the past and plan for the future. So those are all really important points. I think what Louise also says is that it's a springboard for longer term events or longer term activities to achieve change. So I think for a minute, she's talked about working in Ireland to do a pop-up radio station, which is brilliant. I'd just like to turn actually to Pradeep first. What have you done that's been successful on World Mental Health Day? What can people learn from your experiences?
Yeah, okay, sir. So actually, GMHAN was established in 2012, and our first activities were more attached to World Mental Health Day. So there was some government agencies and some other organizations were talking that this is an organization that only working for World Mental Health Day even by then. So thing was, we introduced the butterfly symbol. It was, if you go to our website, you can see it. It was introduced in 2012. Butterfly is symbolic expression of mind. So we think the mind is beautiful, butterfly is beautiful. If butterfly is harmed a little, it cannot fly. So if we if we kind of harm our mind, we have some issues with living forward. So with this message, we went to the government organizations, officers, schools, police stations, many places that we think that we need people to be aware about mental health. In 2012, since 2012 to 2019, many years. Every year we went to the parliament. From 2013, we started to go to parliament. We requested we need to come to parliament, so they allowed us. So we went and met all the members of parliament and the speaker and everyone, and also we met former 3 presidents in mental health days and talked about our requirements. We wanted to talk about a few things. First thing is the accessibility of mental health services, not only medication. We know that in Sri Lanka, medication like the medical based services are very accessible. In every 5 kilometers, there's a clinic in Sri Lanka. So, but other services like rehabilitation services, psychotherapeutic services, counseling services are limited and less accessible. So we wanted to talk about those, and then we went to then we wanted to talk about the stigma and discrimination, and then we wanted to talk about kind of being neglected, people with mental health problems in service provisions and government services, other things. So we talked about these things, and it went really well. So and then we in 2020 we joined with Speak Your Mind, and we joined the Global March. It was really successful, and last year it was the greatest one actually. We were the ones hosted the national event, National World Mental Health event in Sri Lanka with WHO and the Directorate of Mental Health. It was an online event. You have a link in our website. You can watch it now. It was a 1 hour long event with all the services and all the people connected. And GMHAN Lanka hosted the event for the country. So we achieved 4 things from these mental health day campaigns, not especially about from mental health day campaigns, but mental health day campaigns had a lot of influence on these achievements. First thing is mental illnesses are recognized in the disability community. In Sri Lanka, disability is considered as physical disability. Mental illnesses did not consider, but now from 2015, mental illnesses are considered within the disability community. So we are included, and we have a representation in mental health, the disability community organization, disability services. Second one is recognition of persons with mental health conditions in policy bodies, especially the National Mental Health Forum, provincial mental health forums. We have representations. So it was also an achievement we have achieved since our establishment in 2012. Third one is we are like being accepted in in various formats, various forums, and people talk about mental health, especially in the parliament. Recently there was a bill, independent member bill about regulating counseling services. So it came through our advocacy. So it was one kind of recognition, and our advocacy efforts are recognized by the people because we are doing some great job through the mental health day and other related things. And the most important achievement we achieved in last few years was the election commission recognized equal opportunity for people with mental health problems to cast their vote in the election. So it's a official recognition in 2020 general election. So the election commission chairman accepted it in a official briefing. So it was a great achievement that we achieved. So the mental health day events helped us a lot to achieve these things. So I think mental health day has a great role to do.
Thank you, Pradeep. That's a really impressive list of achievements. I don't know that I'll be able to do justice to all of them, but as you said, over the years, you've built up the profile of World Mental Health Day, and you hosted the last World Mental Health Day with WHO and the government of others. And you talked about achievements in terms of integration of mental health within the disabilities community, recognition of mental health in key services, acceptance in forums, and then this wonderful news about the Electoral Commission and the equal opportunity given to people living with a mental health condition to vote and participate in society. So those are all very solid successes and wins. And as Divya has put in the chat, there's more information about the work of Pradeep's organisation there. Ife, what has been successful campaigning for you around World Mental Health Day?
I'd say while we don't have so many achievements like Pradeep, one thing actually really stands out for us during World Mental Health Day. I think our biggest achievement so far have really been around getting organizations, not just not-for-profit organizations now, but also like workplaces to focus on the mental health of their employees during this period. So usually due to promotions and other related activities around the World Mental Health Day, we usually have a huge number of requests in organizations or workplaces reaching out to us to help develop a mental health plan for their workplaces. And this is something that we're really happy about because we're seeing more engagement on that end. Another thing we've been also been able to achieve through our World Mental Health Day activities is drawing a lot of media attention, which is something that usually does not happen. And this in turn, creates that buzz around mental health. More people are speaking up around on mental health issues. More people are seeking help. There's been a really huge spike in help seeking behaviors in Nigeria because mental health is usually something hushed. People would rather seek help from like religious bodies rather than going to the right places to seek help. One important thing we've also been able to achieve is working with other organizations in terms of pulling together or working with other mental health organizations. World Mental Health Day usually affords that opportunity. And what this has blossomed into now is having like a group of mental health organizations putting their voices together to demand change and demand, more participation and more investment from the government. Before we were working in silos, and what we say about individual voices, although we can do all the push, you can shout as much, but then putting all our voices together, raising our voices as one, usually brings forth better results. And we've also seen that the more we raise awareness about Mental Health Day and the more we engage in mental health, World Mental Health Day activities, the more voices we have joining. Now you have other organizations that are not even related to mental health. Most of them, organizations focused on young people, organizations focused on disabilities. Mental health is now gradually being recognized as a disability in Nigeria, or mental illnesses and disorders are now being recognized as a disability in Nigeria, although we still have so much work to do, to get this to the, all corners and top spaces of recognition. But it's been so much progress for us. Looking back at 2016 when we started operations at Mani and the state of mental health in Nigeria at that time, and seeing what it has blossomed into now, we really have high hopes for the future, and we're hoping that World Mental Health Day activities in collaboration with other mental health organizations this year will be the final push to pass the mental health bill into law in Nigeria.
Thank you, Ife. That's a really clear objective for this year's World Mental Health Day campaign for you, which is around passing that mental health bill. But as you said, that you've already used World Mental Health Day to help engage people around workplace mental health, to help generate more media attention, and now the strength, as you said, of coordinating with others, which is so important. Mohammed, I'm going to come to you about what you've done with World Mental Health Day. What advice would you, what can you see that you've done that's made a difference? And then we're starting to get lots of questions, so I'm going to come to the chat in a minute. So go ahead, Mohammed.
Yes, thank you so much. So I believe usually our campaigns aimed to raise the awareness of the medical students, not just because they learn about the mental health issues and disorders in medical school. So this is not the case, but we need to teach medical students, and we need to teach youth how to understand more about mental health, how to communicate with the community, how to engage people around them, and how to prevent mental health issues from happening in the first place. So this, when we work about mental health within our standing committee on public health, it's really public health. It's not just about diagnosis or treatment, which is something we learn in medical schools, but it's about, for example, how to deal with a patient, or how to deal with someone living with a mental health issue, or how to provide support. For example, one of the things that started after our World Mental Health Day campaigns over the years is that we initiated a whole new workshop called Mental Health Essentials for Future Healthcare Professionals. where we started teaching medical students about, like, for example, psychological first aid, the right mental health terminology, things like that, in order to be able to use them in their everyday lives, not just with patients in the hospitals, but also with their communities. So that's the first thing. And what, like, also there are some lessons learned, but there's always room for improvement. And what I can see for like future campaigns and even advice for people seeking to do campaigns and do work on the World Mental Health Day, it's the importance of being evidence-based and the importance of not just providing knowledge and that's it. People need to understand, okay, when I get this knowledge, what will I do with it? Because people can get the knowledge just from the internet or like books or whatever, but we need to provide them with the skills and competencies on how to use this knowledge, in addition, which is very, very important, to ensure the sustainability. World Mental Health Day is just the start of so much work to happen during a whole year. So we shouldn't stop at World Mental Health Day, do a campaign and think that, okay, we succeeded. No, success requires more time, success requires advocacy, and success requires long-term impact, which should start by our activities on the World Mental Health Day together, and not just doing things on our own and not joining forces together. Thank you.
Thank you, Mohammed. That was really inspiring. I think, as you said, medical students have a particular role because they are the future for care of mental health care. And so them understanding and being able to use their knowledge for good on mental health is really essential. So I think it was really good to hear about them as agents of change, the idea of public health, about what you were saying about training them in first aid, mental health first aid, so that they can help others. You were interesting when you were talking about the point about what you would advise others planning for World Mental Health Day, and I think that's come up a bit in the chat. So you'd mentioned being evidence-based and thinking about this as beyond one day, but across the year. I think it's come up in the chat already, but perhaps the panelists could answer for me. What advice would you give people planning for World Mental Health Day? Maybe Pradeep, what would your advice be?
So Sarah, I missed something. Could you please repeat?
Yeah, no, I'm asking what advice would you give other organizations who are making plans for World Mental Health Day?
First thing is you should plan ahead, because when you go to media, when you go to public, they have their own plans. So let's say sometimes we get an appointment from the president maybe 4 or 5 months before, like that. So you should start ahead. First thing. Second thing is, as in a question asked here, the World Mental Health Day, the global theme, it is a guide actually, but it should not be the like direct focus from your organization. Maybe your country have your own problems. Maybe you have more priorities for your culture. So you can address those issues. You can talk about those issues in the World Mental Health Day. It should be World Mental Health Day, but still you can use your own plan. So it should not be a copy of some other organization or something like that. And third one I can suggest is use some symbols as we use butterfly, because every year when it comes to World Mental Health Day, everyone sees the butterfly in the television. Media people and the parliamentarian president, everyone is wearing a butterfly. So it has become symbolic and people know that it is about mental health. So you can use your own symbols so that it is more prominent and more specific. So those are the things that I want to suggest the new organizations when they start their own program.
Thank you, Pradeep. Ife, would you have any advice? We heard a bit from Mohammed of some advice, but you could have yours and then another question.
Sure, Sarah. One thing I would say is don't underestimate the power of collaborations. Like Mohammed said, if you're a small organization just starting out, look to other organizations, share your ideas about what you're trying to achieve, particularly if you have very limited resources or you have limited capacity for these events. Trust me, you working together always brings better results. You can collaborate with other organizations. Just start with what you have. Look within your space, look in your network. It may be something, seemingly not so on topic, but you can go to a school, you can hold an event in a school, you know, you can reach out to media bodies, you can host a virtual event. You can, there are so many things you can start off with that do not require you spending so much money or you needing so many resources. So try as much as possible to collaborate, look at what is within your means to do, and just remember that mental health is the message, no matter the medium or no matter the event you're having.
Thank you, Ife. I think that speaks well to the question in the chat about how small CSOs can start, who is just starting up, can follow in the success of you and what you've done and the team in Sri Lanka. So it sounds like working in collaboration with others is really important, and working on thinking about planning ahead, about having a strong symbol or something that people can recognize. And then using the global theme as a guide, not necessarily as what you have to focus on. I wondered whether it would be good to hear from Mohammed. Valentina's been asking about how does the mental health community make sure World Mental Health Day provides a united message worldwide. So how do you work to have a united message worldwide? And at the same time, as Pradeep says, obviously people will need to do their own thing at country level according to their context. So what do you do to help your members in the run-up and at World Mental Health Day?
Yes, thank you so much for the question. So I guess one of the first things that like we don't do, it like comes to us is having a theme for the World Mental Health Day. This theme is a first step in order to unite the message when it comes to what we need to like communicate to the communities when it comes to the World Mental Health Day. So that's the first thing. In addition, that we usually work, like we started working recently for every campaign to have like a social media toolkit, a toolkit of like some infographics, some flyers, some even things that they can use in physical campaigns in order to use on the national level as well. So these infographics and these things, they are prepared and they are also like available to adapt to some changes according to the communities, because we believe at the same time, as we mentioned, there are so much cultural difference, there are so much even differences when it comes to social determinants of mental health. So when you're speaking to different communities, you need to identify what are the factors affecting this theme or the mental health of the people in this community and be able to tailor the message to them. Like one simple thing I would say, for example, if I'm speaking to, I come from Egypt, if I'm making a mental health campaign for Egyptian people, the first thing, for example, I wouldn't make it in English because like it's not the language that you are speaking. If I'm speaking about something, I would make it relevant to, for example, the national situation or things that are happening on the national level. This way, they will be able to find that the communication is an advocacy communication, something that is relevant to them and something that's touching their everyday lives and everyday exposure to determinants of mental health. So in conclusion, I would say having a theme, having toolkits and having things that are adapted or they can be tailored to change according to the different communities, and of course identifying the different determinants of mental health in the communities and be able to use them in accordance with the theme of the World Mental Health.
Thanks, Mohammed. I think that's really helpful advice. So as you said, the tailoring of messages, so having things in the right language is really important. And then also thinking about social media toolkits, so things that you can share with others. We've had a few more questions, so I wanted to have a look at those. It says many policymakers make commitments around on mental health during World Mental Health Day, but they don't follow up on them. So how can we ensure commitments are changed into action? Pradeep, you've worked with the government to make commitments. What do you do to follow up?
Yes, regarding follow-ups, right? Yeah, so thing is, in my experience, if we ask for 100, we get only 10%, right? So what we have to do is we have to call again and again and again. So we have some members of our board, they call every day to these people sometimes and see what has happened. And also we use different channels at the same time. For example, we write letters sometimes, we meet personally the relevant officials, or we reach through some other organizations, such as, let's say, if we want to talk about something to the government or health ministry, we will talk to the other organization like College of Psychiatrists or National Institute of Mental Health. So we talk to those people. So they will also be helpful. We talk to them. So sometimes progress is not so good as we expect, but still we are fighting. So first thing we do to see the progress is we monitor if these things happen. For example, in the COVID period, we were asking a lot of times about disability specific guidelines, but it didn't happen for quite a long time. So some incident occurred. So we need to talk to media and all other the social media channels, so that only we could achieve those things. So first thing is we don't know to stop. We try hard. We talk to different people, and we try to convince them by other means like not illegal means, but the more influential people than people with mental health problems. So those are things that we do to get this done.
Thank you, Pradeep. I think that's really useful. So some of the ways to make sure policymakers listen to your message and respond that Pradeep mentioned were having members who call member of parliament's offices and just keep demanding change, sending letters, following up through other partners. So the College of Psychiatrists, I think that you mentioned, maybe members of Mohammed's network as well, working with medical professions, medical organizations, and then using the media to draw attention to issues. I think that's all really helpful. Ife, did you want to add anything about how you've been demanding that your policymakers make good on the changes that they've promised?
I'll say this is currently a big problem we have because we have several promises made, not only on World Mental Health Day, but also at international meetings, and nothing ever comes out of it. While Pradeep said that making phone calls and things like that has worked out in this country, it's quite a different scenario in Nigeria because if you put that much pressure from an individual on a lawmaker, you're most likely going to get locked up. So what we try to do mainly is just to try letters, and we also try as much as possible to ensure that we get people talking about these things. We get people demanding in different spaces, especially on social media, because politicians are always very, very conscious of how their image is or what people think about them on social media platforms. So getting people to talk about this and tagging them and asking them to take action is what we've been doing so far.
Thank you, Ife. I think that's really helpful. There's a couple of questions that I've just noticed. So just trying to come back to those. So Erla's just said that for the public in many parts of the world, sadly, when they look for support, there won't be any. So how do we respond to that? How do we ethically communicate the importance of mental health when we know that support is limited? Mohammed, do you want to take that question? And then I'll ask Pradeep and Ife. It's really important. If you create demand, what happens? Where do people go? How do you solve that problem?
I'm sorry, but I just can't find the question. Where is the question?
It's towards the bottom. So it's about the last question. What's asked is, and this comes up a lot, if the public, if you raise awareness in the public about mental health, but there's no service or support for them, what do you do? What do you do on World Mental Health Day or on other days? Where do you send them for support? Where would you signpost that they go to?
I'm sorry. Can you type it in the chat maybe?
I'll do that, no problem.
I'm very sorry.
That's okay. I think Ife and Pradeep are very used to this issue. So Pradeep, do you want to answer? What do you do when for World Mental Health Day? Who do you signpost support to?
Sorry, Sarah, it is about this.
I think what you find is that when you start raising awareness of the issue of mental health, people then want support and they reach out asking for support. So what do you do through your social media channels or maybe on your website for people who are looking for mental health support in Sri Lanka? What would you say to them?
Yeah, I still didn't get your question. What's the last question?
That's okay. Well, it's let's see if Mohammed or Ife can answer, and then I'll come back to you. I think it'll be easier in the chat. Ife, you unmuted, and I know Manny does a lot, and then I'll come to Mohammed. Go ahead, Ife.
So one thing we do ahead of you know, notable dates like this, particularly around mental health and World Suicide Prevention Day, World Mental Health Day, Men's Mental Health Month, and the rest is we ensure that we have enough volunteer counselors on ground to take on those requests. And because a whole lot of people come in with their request, you know, post awareness, you know, oh, this is how I'm feeling, and I feel like your organization understands that, and you know, is voicing that I should seek support. But where do I seek support from? So apart from us clearing out our end and ensuring that there are enough people to take on this request, every World Mental Health Day, we also do our stranger support, which is an activity we do every last Friday of the month. What we do for stranger support is we have a form that people fill in, and then we just call them, and you know, they get to talk to someone immediately. So from there, if they need further mental health assessment, treatment, you know, we just immediately refer them to the appropriate channels. And we have a database of mental health facilities and mental health professionals in Nigeria that we refer them to across the 36 states of the country. One other thing we do is, because we understand that we don't have the capacity to support the whole of the country, so we are always very happy to refer people to other mental health organizations that do the same work. For example, for people who have come to us for mental health counseling regarding cases of like domestic violence and sexual abuse, we have a partner, Stand to End Rape, that we refer them to. For maternal mental health, we refer them to Postpartum Support Network Africa. So we have these organizations we already worked with, just because we understand that when we create that level of awareness, we're going to get a surge in requests. So we always prepare beforehand to handle that surge.
Thank you, Ife. I think that's really important. So with World Mental Health Day, you'll have more people contacting you wanting support. So Ife was saying that they have volunteer counselors ready, like a greater number than normal days, that they have opportunities for people to fill in a request for support, and they signpost to other organizations. And I know Manny does quite a lot of messaging on social media about self-care and about things that you can do to support your own mental health. Mohammed, you had your hand up. Did you want to add to that?
Yes, exactly. Like briefly, what I wanted to say is the importance of community engagement again at the first place. Because when we engage them through all actions, through everything, they will understand that there are more steps to be taken. And it's also important to add to whatever campaign or whatever activity that we're doing, how they can seek support or how they can get support, whether from formal like initiatives or even informal ones. So I guess this is important, the community engagement and providing the information about the means of support.
Thank you. I think, Pradeep, would you agree the same things?
Yeah, so yes, so and in our context, actually, the many organizations provide these services. So collectively, we work with you know, mostly in the publications and yeah, websites. They have their links. The government lines also there, so that people can reach out there.
Great, that's really helpful. Thank you very much. So I think in the chat there have been resources that are available across different countries if people are interested in looking what other countries are doing. There's also been a question, I think, from Sana and others about how can I get involved in what's happening around the world? What can I do as an organization to get involved? We talked a little bit about that, but maybe, I don't know if Ife wants to start. How does Mani link up with other organizations?
So we're always very happy to collaborate with other organizations. You can send us an email. I'll be happy to put that in the chat box, an email address you can reach. You can message us via any of our social media channels. We're always very open, as long as it's in line with our organizational goals. But one of the ways we can collaborate, particularly with organizations out of Nigeria, is we can hold, virtual events together. We can support each other with communication materials like toolkits. We can provide further support. For example, when Nigeria had the NSAS protest, which was protest against police brutality. SADAG in South Africa actually helped us take on a number of requests into our virtual counseling center. They helped us handle some cases that period. So we're happy to do that too. We're happy to reciprocate that to other organizations that need our help during this period.
Thanks, Ife. So the idea of doing joint webinars or joint events, sharing communications materials, and as you said, at key moments, maybe even supporting one another with counselling services and support. Pradeep, how do you link up with others? What can people do to link up with one another for World Mental Health Day?
Yeah, so for Mental Health Day collaborations, what I think is, in my experience, actually we did first in a little, like as a little organization, we showed something so that other organizations can see it and they can join with us. Maybe different organizations might have different agendas, different priorities. So maybe we need to come together and come to a central point that everyone can think of and everyone be agreed on, so that we can work together and join organizations. So we work with different organizations, like several organizations. Some are CSOs, like the disability organizations Joint Front, and some other such organizations like Sri Lanka, Enable Lanka Foundation, those kind of organizations. We work together because one of our main priorities were the protection of rights of persons with mental health problems, especially after Sri Lanka ratified the UNCRPD in 2016. We started to work closely together to achieve the CRPD objectives. So when it comes to World Mental Health Day as a new organization, what I think is you should start first. You should maybe first thing, either you can do a small event for the mental health day at your capacity and show other organizations that you are doing something. Otherwise, or you can give a proper proposal to other organizations that we are planning to do this. Would you like to join us? So both did work for us actually.
Thank you. Yeah, no, that's great. So different ways to collaborate, including around World Mental Health Day, so doing events with others. That's helpful. Mohammed, how can people join IFMSA? Some people may not even, there may be medical students on this call or reading the notes who aren't members. How can they work with you around World Mental Health Day or throughout the year? I think Mohammed's having trouble with them. While we've been going in the chat function, you'll see lots of information that's being shared. People have been asking about linking up globally, and obviously the Global Mental Health Action Network is a great way to link up with other people and organizations for World Mental Health Day and throughout the year. So you can find more information about the network and about the different working groups. The different working groups are working on different themes, and that gives you the opportunity to work throughout the year on a topic with others. I think just as a reminder, the theme for World Mental Health Day this year has been set by the World Federation for Mental Health. I put it earlier in the chat. It's quite a broad theme, which gives us opportunities to try and raise whatever issues you feel are most appropriate to you in your settings. So if people are interested, you can find a bit more information about the theme and about what's happening over time. And so the theme this year is make mental health and well-being for all a global priority. Mohammed, did you want to add?
Yes, I'm sorry, just the laptop froze for a moment. So yeah, like what I would advise is that whoever would like to collaborate, you can send me an email. I will drop my email in the chat. You can send me an email. If it's a global collaboration, I would love to. If it's a national one, I would connect you with the national member organization in this country, and you can work on this together. So
thank you. That's really kind. Thank you very much. I'm going to move on now to think about other things that have come up in the session today that may be relevant. So Ife, you talked about your paper that you've been working on around COVID. COVID is still a very real reality for many people, including on this call. So did you want to talk a bit about your research in case people are interested or things that they might like to take away from that?
Thank you, Sarah. So last year we launched a study on the effect of COVID-19 on Nigerians. We looked at this from different aspects of living, the economic effect on the psychosocial health, the effect on, on how their financial, the financial crisis too has also affected their mental health. We basically did this research because we wanted to have actual numbers from Nigeria. As many of you know, when it comes to mental health in Nigeria, we don't really have a lot of actual data. A lot of them are just we just use like world data for some of these things, and we did this mainly because we wanted to use it to push for advocacy, wanted to use it to call on our national leaders to act for mental health in Nigeria, wanted to be able to present something to them in this regard. We are happy for you to download copies of this study. Our website is currently down, but if you check through any of Mani's social media pages, Mentally Aware NG on Twitter, Facebook, Instagram, you'll see a link to download this study on our channels.
Thank you so much. Yes, and there's been a link put in by Emma, which was kind. Mohammed, your members must still be impacted by COVID. Is this something that you're supporting them with at the moment?
yes, so in terms of COVID and mental health, when it first started and everything started, we worked on creating campaigns and creating awareness campaigns. When it comes to COVID, we usually included the mental health perspective in order to make sure that they understand what they can, what they should expect from the pandemic and how they should deal with it. So this is something that we have worked on through our campaign, through our webinars, through our sessions, in order to make sure that everyone is at least occupied, empowered somehow in order to be able to deal with the mental health impact of the COVID-19 pandemic. So yeah, we did this in our internal campaigns, not even just on the global level, but also on the regional level as well.
Thank you. And Pradeep, you've written recently about the impact of the economic crisis in Sri Lanka. Did you want to add something about that and what's happening at the moment?
Yes, Sarah, it's a great opportunity. Sri Lanka was hit by two waves. First thing was COVID. COVID affected Sri Lanka a lot in 2020, the later part of 2022, April, May of 2021, we had a big wave of COVID-19. And then Sri Lanka is facing a very huge economic crisis after 70 years of its independence. So Sri Lanka is, the infiltration rate is now 45% by yesterday reports. So Sri Lanka has no medication for most essential medications, no gas, no fuel. Sri Lanka is in very bad situation. So actually in mental health sector, there are 16 shortage drugs. The Directorate of Mental Health has issued 16 list of 16 drugs that are essential to mental health services, mental health care. So we have requested to the UnitedGMH and some other organizations from our international supporters to help us to gain these medications, because they are less prioritized. So when they are prioritized in the life-saving drugs, mental health drugs are less prioritized. So but they are essential for the people with mental health problems living in Sri Lanka. So we have been requesting our global partners, friends, to support us in that case. Post, actually, the Ministry of Health has started a line to get these medications. It's a donation account and a procedure. So as Kline Sri Lanka, we can support this process. We are not going to ask for money from any organization. They can donate to the Ministry of Health website, the account, but we can help with the process. So we would like to request all of the partners to help us if in any way that you can, so that we can get these essential 16 medications for people with mental health conditions in Sri Lanka.
Thank you, Pradeep. I know that we're coming to the end of our session and we've covered an awful lot, which has been really brilliant. I'm so grateful to all of you for your inputs, and also to the panel, not just the panel, but also to the audience who've given a lot of information. So in a tweet length response, could each of you say, this World Mental Health Day, we should prioritize something? Mohammed, did you want to start? This World Mental Health Day, we should prioritize.
Yes, thank you. I believe in this World Mental Health Day, we should prioritize the determinants of mental health, sorry, and the root causes behind the mental health issues and disorders in order to be able to treat them and prevent them at the first place. Thank you.
So the determinants of mental health. Ife, this World Mental Health Day.
This World Mental Health Day, we should prioritize access to service for individuals living with mental health conditions.
Thank you. Access to services, Pradeep.
Yeah, in this World Mental Health Day, I believe we should prioritize the mental health of general public, everyone in the community, so that everyone is affected, so they need this support.
Thank you. I think that's really important. So support everyone's mental health. Everyone has good and bad mental health at different points in their life. They all need their support. Thank you so much for all that you've shared today. There's some really lovely thank yous coming in from the chat. As a reminder, the next session is on education, and it will starting in half an hour. And there's more information on the chat about registration. So we're really grateful to all of you for participating. Through the Global Mental Health Action Network, you will learn more information about World Mental Health Day in the coming months and how you can get involved. But thank you very much to the Ife, to Pradeep and Mohammed for being with us. We're really very grateful. We look forward to hearing a lot more about your work in the future. Many thanks.